It is bigger now than ever before. At least more people are talking about it. More Americans turning to plastic surgery to fix something they may not like. High-profile people like talk show host Greta Van Susteren just recently turned to plastic surgery. She lifted her eyes maybe a little bit more. And then there's Arizona Senator John McCain, who after having surgery to remove skin cancer also had cosmetic surgery. In 2000, nearly 7.5 million people had procedures done. For men, the most popular was the nose. For women, liposuction. And for people 51 to 64, eyelid surgery is the most common. Our next guest is familiar with these procedures. He joins us live with more, Dr. Richard Maloney. And thank you so much for joining us today to talk about this. And I think the biggest one, if we could just start with Greta Van Susteren, because she kind of let it all hang out. Are you seeing that more people are saying, hey, I'm having surgery?
I certainly do. At the Aesthetic Surgery Center, which our practice in Naples, people are not necessarily afraid to tell someone that they've had cosmetic surgery done. Like Greta, they may not tell the whole story. They may only tell a part of it, but they're willing to say, hey, you know, I wanted to do something for myself. I wanted to feel better about myself. I wanted to look as good as I feel, and say they have the courage to go out and do it, and they're proud of that.
Let's take a look at her. If we could just set up this shot, and we'll give it a minute, because we were just talking about possibly what she had done, and what she said that she had done were her eyes. Mm-hmm. But when you look at even this picture on People magazine, you could see possibly a little bit more. Just as we're getting the picture, talk about what you think she probably had done as well.
Well, you can see her eyebrows are a lot higher than they were before, and so I would expect that she had an eyebrow lift as well. She certainly did have her lower eyelids done, and her whole middle portion of her face is lifted and tighter and firmer, as well as her jawline and her neckline.
Yeah, her neck looks real smooth. But then, now look at this, because I've heard people talk about this right here in her eye. It looks kind of odd.
Well, it does, because the lower eyelids are still a little bit too tight, and it could have been the method that the surgical procedure was performed, and she looks a little bit slanty-eyed still. Her eyes look like they're squinting too much.
But even if she had this, because she went off the air and she was off for only about a month, so really a month isn't that long, especially if she indeed had all these things that we're talking about. Usually we're talking about a longer recovery time before, especially with something like that when you have to go back on air.
Well, yeah, I would say my average patient is back to doing things normally and naturally between 3 to 4 weeks. With the newer endoscopic or minimally invasive procedures that we do, the return to work time is much shorter because there's less swelling and there's less puffiness. Plus, you don't have to necessarily do you can do the work that's just necessary for that individual person. You can kind of like build a facelift, so to speak, for that individual person, so you don't have to over-operate on them. Many times over-operating on people is where the excessive swelling and facial distortion comes from.
And when we talk about cases like John McCain, because he actually had some cancer removed from his face, so that was really, isn't that the cosmetic surgery that he had? Or was there other stuff too?
No, for him it was mostly reconstructive because he had some skin cancers removed. He had a melanoma removed first, and then he needed that area reconstructed. That's why he wore the patch on his left cheek for so long. And then he just recently had a lesion removed from his nose that required a more minor form of reconstruction. But you can see it all looks very good because he looks very good on television.
And would you say overall that over the years that there have been improvements, and now any kind of surgery really is just looking great? I mean, whatever you want, from the nose to the liposuction to whatever.
Yeah, what's happened is that consumer demand, you can figure the number of cosmetic surgeries that have been done in the past 8 years has basically doubled. And what's been driving it, just like everything else, been driven by the baby boomers. It's an aging population that still wants to look as good as they were when they were 10 years younger. They take care of themselves, they live a healthy lifestyle, and it's really self-improvement and not selfish improvement.
All right, Dr. Maloney, thank you so much for stopping by. We have a phone number if you would like more information. Go ahead and give them a call. That's down in Naples, 941-594-9100. Trent, over to you.